Assalamualaikum warahmatullahi wabarakatuh and a very good morning. Welcome to our talk regarding exclusive breastfeeding. My name is Nur Shakira Arisa and today we are going to talk about exclusive breastfeeding, statistics, its benefits and also how to properly breastfeed.
Assalamualaikum, I'm Arif. Without any further, let's talk about what is exclusive breastfeeding and the data regarding exclusive breastfeeding in Malaysia. I'm sure that everyone already knows about what is breastfeeding, but maybe some of you may not be familiar with exclusive breastfeeding, which is the act of feeding infants with only breast milk. This includes breastfeeding from a wet nurse and feeding of expressed breast milk. The recommendation from WHO and UNICEF is to initiate breastfeeding within the first hour of birth, and the infants must be exclusively breastfed for the first 6 months of life. Next is about breastfeeding awareness. The data is from National Health and Mobility Survey, the second and the third one. So from this data, the prevalence of exclusive breastfeeding below 4 months for the second NHMS is 39%, while for the third NHMS is 19.3%, which indicate the significant decline of 9.7%. Next is the prevalence of exclusive breastfeeding below 6 months. The data from the third NHMS shows that the prevalence is 14.5%.
Assalamualaikum warahmatullahi wabarakatuh. My name is Fatina binti Azli and I will continue for the benefits of breastfeeding. Some of you might think, why do you have to breastfeed? Is it important? Yes, it's really important to breastfeed the baby. Why? Because it gives a good benefits for you and your baby too. First is the benefit for the baby. The breast milk provide ideal nutrition for the baby, which consists of cholesterol that high in protein and low in sugar. It also contains antibodies like immunoglobulin A, which act as the first line defense for the baby by performing the protective layer. Then, breast milk also will help to reduce the risk of disease like asthma and also allergy to the baby. Next, breastfeed can help to promote a healthy weight gain to your baby and also will make your baby become more smarter as it helps with the long-term brain development. As for mothers, breastfeed will help you to lose weight faster as it burns extra calories to make the milk. It also helps the uterus to contract and return to its previous size. Next, when you do breastfeeding, you can reduce the risk of getting breast and ovarian cancer. Besides that, you don't have to prepare and buy formula milk, which saves your time and money. Lastly, continued breastfeeding can help to pause the ovulation and menstruation cycle.
Next, I'll explain on how to breastfeed correctly. This is important as every mother has different position of breastfeeding that will work for you and the baby. But the basics that need to be fulfilled are the position must be comfortable for you, position the baby close to you, support your breast, and latch the baby onto your chest. So the first is cradle position. This position is done by cradling the baby across your lap. The baby should lie on his side and resting on his shoulder and support your breast with U or C hold. Next is cross-cradle position. This is commonly used in the first few weeks where this position gives you more control. If you breastfeed your baby using right breast, you need to support your left breast in a U hold. Football position is the best, especially for mothers who go through cesarean birth, where this position keeps the baby away from the incision. Other than that, you can also use laid back position, or also known as biological neutering. This position needs you to lean back on bed or couch and use a pillow to support your back, head, shoulder, and arms. And lastly is side lying position, where most mothers find that this is the best position, especially at night. This is done by both mother and the baby lie on their side facing each other.
Okay, so the conclusion is exclusive breastfeeding is very important for the baby, especially in the first 6 months of life. This is because they are needed for optimal growth and development. Thank you. And this is the references that we use. Alright, we have come to the end of our session. Now we're going to proceed with the Q&A session. So if there's any questions that people might want to ask, they can ask right now. Okay, thank you for the questions, and that is the end of our program. Thank you for my friends and Dr. Wee and also the audience for listening and watching and sticking with us. Thank you.